Good afternoon, and thank you for coming here today. So I wanted to talk to you guys all about the schizotypal personality disorder. Statistically speaking, people in this room, you're never going to know anybody who's been diagnosed with the SPD, schizotypal personality disorder, much less know anyone directly related to it, diagnosed with it. My purpose here today is to help inform you about what schizotypal personality disorder actually is, the different causes of, the signs and symptoms, the treatment, and the prognosis of. I became interested in this subject because of all the different classes, all the different psychology classes that I have taken. I became aware of this personality disorder and the small amount of the world's population that has actually been diagnosed with it upon taking an abnormal psychology class. While in class, I did a presentation of it and gave it to my peers as well as the professor, where we all learned a little bit something else that the book was not informing us of. So while it's true that you might never come into contact with somebody with this diagnosis, it's always fun to watch television, such as The Big Bang Theory, and see Dr. Sheldon Cooper, and then you can point to everybody and go, that is a perfect example of somebody what the schizotypal personality disorder, or SPD, actually is to identify exactly what SPD is, as well as the causes. There are only 6 recognized personality disorders, and of those 6, they're broken down into 3 clusters. SPD is regarded as cluster A, which is characterized by odd, eccentric thinking or behavior. Now that we know this, we need to find out exactly what causes the schizotypical personality disorder. The first thing that's known to cause schizotypal personality disorder is genetics, whether or not your mother or your father has it. If they do, you have a 50% chance of later being diagnosed with this disorder. The second thing known to cause SPD is malformation of the frontal lobe during the prenatal development. This is the area that personality as well as impulse control comes from. Third item believed to cause SPD formation is environmental factors. This includes trauma, abuse, emotionally detached parenting, or some sort of trauma and stress.
Mom, I can't hear it.
So now that we know what causes SPD, we need to learn to identify what the signs and the symptoms are. It's kind of easy because we can break it down into 3 separate groups. We can break it down into behavior, speech, and social. So first, let's talk about what is different in this person's behavior. They will begin to exhibit suspicious and paranoid ideas. They will have a flat affect, and they will continue as they move farther and farther away from everyone else. They begin to have displayed depression as well as anxiety. Second, let's talk about how a person's social interaction is affected. This person will not have any close friends outside of their family. They will experience social anxiety that seems to be excessive as well as persistent. This is not something that they can turn on and off. Lastly, these individuals will begin to use odd speech that includes unusual words or phrases. So now that we've talked about what causes SPD, as well as what the signs and symptoms are, we need to understand exactly what the treatment is for this. And the first thing that the doctors will usually do is prescribe medication. However, there is no one drug that sits there and completely cures or helps the person who's been diagnosed with this. So what they do is they go ahead and there's 3 drugs that are prescribed for a person with SPD. One is antipsychotic drugs, and that's used to help the person help with his illogical thinking. The other 2 are your antidepressant drugs, as well as your anti-anxiety drugs. Second part that is imperative to a person's treatment is your group therapy, your talk therapy. This is going to allow the person to exactly gain a better understanding. Group therapy will help build trust with others, and the social skills training will help manage symptoms. And last part that is probably the most important to a person's treatment is their family's involvement in their treatment. The more a family is involved in helping a person in their treatment is going to be the person's family's So let me conclude by briefly reiterating the causes of the signs and symptoms and the treatment. So let's go ahead and do a quick recap. We learned the different causes of included the genetics, prenatal formation of the frontal lobe, as well as environmental factors. Secondly, we learned the signs and symptoms included odd speech, depression and anxiety, social anxiety that is excessive and persistent, suspicious and paranoid ideas, and lack of close friends. Then, finally, we learned about the treatment, which included the medication as well as psychotherapy and a family's involvement. So I believe that this information is going to be more useful for you when you sit around and you watch television with a group of your friends or your significant other. And you can point to some personality on television that you're watching and sit there and say that that person right there has indeed have schizotypal personality disorder. So I want to say thank you very much for listening and taking your time. Thank you.
Yeah, good job.
Thank you so much.
That was good. Short and sweet.